Hello everyone, I hope and I believe you all are doing great. This is Dr. 𝗲𝗵𝗺, your pathology faculty. Today we will be starting with a new segment, that is your skeletal pathology. Okay, here we will be talking about the pathological segments of your skeletal system which you need to know at your level and which are important for your exams as well. So this is the first lecture, that is the introduction lecture, right? So let's start. Bone structures are basically the fundamental human anatomy and physiology, framing the framework of the body. Okay, so bone structures basically, why, what they are responsible for? They are responsible for framing they provide the framework to the human body, right? To the human body. That is why they are important. Next you need to know is about the types of bone. I am damn sure you have read that in detail in your anatomy lectures as well. But let's just see it for a revision, right? First one, you have mainly three types of bone. What are the three types of bones you have? Either the long bone, then you have the short bones, and then the flat bones. You have other types of bones as well, but this much you need to know for understanding the pathological segment. Okay, so long bones are the bones of femur. Then you have the short bones like your carpal bones, and the flat bones is your skull bone. Okay, next, the thing that I want to tell you is about the bone components. You have the components as, if I draw the bone over here, like let's say, let's just draw a bone. Okay, so what are the segments of bones you have? First one is your diaphysis. Then you have epiphysis. And you have the metaphysis. Okay, so diaphysis is the shaft of the bone. Epiphysis is the end part of the bone, and metaphysis is for the growth plate area of the bones. Okay, any defect in that area will lead to the growth failure, right? Now, next we have is the bone marrow. So, why bone marrow is responsible? Bone marrow is basically critical for the process of hematopoiesis. Okay, and this is the process of hematopoiesis which is going on. It exists in two types, either it on the red side or either on the yellow type. It is essential for the red cell production or the red blood cells production, and they also store the fat, for the storage of the fat. Okay, next that you need to see this is the microscopic bone structures, right? Next, what are the features you have? You have the osteon structure, that is your Haversian systems, that is known as, right? Then you have the laminar arrangement, that is your bone layers. Lamellar arrangement are for your bone layers, right? Like how layer by layer your bone is getting aggregated. Then you need to know about the difference between a compact bone and a spongy bone. See, compact bone mainly have a dense structure. Whereas the spongy bone have a cancellous texture. So we can just distinguish this kind of bones based on their structure that they persist. Okay. If I talk about the bone matrix composition, then you have mainly two types, the organic and the inorganic one. So what is the function? They helps us in providing a structural integrity. And they are essential for the bone function, and they are essential for bone function. So these are the two things which you need to know in the bone matrix composition, that there are two types only, organic and the inorganic one. They are responsible for the structural integrity and maintaining the bone function. Okay. Next, if I talk about the bone physiology, then you need to know that about the mechanism, mainly mechanism and function, that how the bone helps us, right? So if I talk about the overall function, bone basically helps us in maintaining the mineral balance and the overall health. Right. Next, you have the mechanical function. It is essential for support and protection, right? That is why it acts as a framework. It acts as a framework for the body. It acts as a framework for the body. Like above the bones, you have your skin and all that things, right? So it's like when you wear something, so you have a proper base for that, and on that base you overlay the things, right? You wear your coat, you wear your anything that you want to wear, right? Similarly, the bone is like the framework to our body. Next is the metabolic function. What are the metabolic functions? They are responsible for what? They are responsible for the mineral storage. They are responsible for the mineral storage. Okay. Next that you need to know about is the bone remodeling. What is bone remodeling? It is a dynamic process. It is a dynamic process that maintains the bone health by balancing the resorption and formation of the bone. See, it basically helps us in reframing the bone structure and maintaining the lifestyle of your bone and maintaining the health of your bone. So it basically repairs the micro damages. Like if by any chance your body has suffered from any of the accident or any of the injuries, so the process of bone remodeling helps us in repairing those scars and repairing those things, right? Repairing your bone and giving your bone a new lifestyle, right? Next that you need to know is about the hormone regulations. What are the main hormones you need to know is about the parathyroid hormone, then you have the calcitonin, then about the vitamin D. See, vitamin D is very, very essential for your bone health, right? And these hormones are basically for the regulation. They are responsible for the regulation of bone metabolism. We will study these hormones as well in details, although you have read that in your pharmacology or physiology, I guess, but still we will just read them in details, okay? Next that I want you all to know is about the diagnostic imaging. See, imaging process like your CT, MRI, X-ray, they will act as a therapeutic measure in your pathology when we are discussing about the bone pathology, especially because these are the things by which we can diagnose it. In a patient who is suffering from any bone disorder, it's very difficult for us to diagnose that patient on a clinical basis, right? So there the CT, MRI, X-ray, they come into the role, and there we are able to make that this is the diagnosis, okay? So you need to know about that. These are mainly the views that I have written. If there is a fracture of the femur, then you have to take the lateral view. If there is vertical compression like this, you are able to see, then you have to take the anterior view. And if there is a wrist fracture, you have to take the X-ray of that particular thing. So this was just an introductory lecture. We will cover in very details so that you will be able to understand each and everything. We will cover each and every topic from your Robbins as well. Okay, so don't worry. Just stay calm and just study pathology. If you are having any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you so much.